morning, Sammy. I'm going to be your nurse today. Can you just tell me your name and date of birth for me, please?
Kirsten Kaiser, 11/24/1997.
Okay, thank you. And what brings you in here today?
I think it's my medication.
Okay, let me check your chart. Has anything changed since the last time we met? Anything you want to tell me?
No, but there's these voices.
What are they telling you to do?
They're not telling me anything, they just keep laughing at me.
How do they make you feel?
I don't know.
Okay, are the voices telling you to harm yourself or others?
No, they just laugh at me.
Okay, does the medication help you at all?
Yes, makes them go away.
Alright, that's good. Let's discuss your medication schedule.
What about it?
Did you take your medication yet today?
No, but I take it 2 times a day.
Okay, great. Can you tell me what medication you're taking?
What's it called? I think it's like Halo or Halo, something with an H.
Okay, you're taking Haldol. The generic name is haloperidol and the brand name is Haldol.
Oh,
This medication is a first-generation antipsychotic.
but I'm not psychotic. I just hear voices.
No, I'm not saying you're psychotic. This is to treat your diagnosis of schizophrenia.
Oh yeah, I got diagnosed last month.
Okay, yes, I see that right here in your chart. Let's talk about the medication.
Well, what about it?
Can you explain to me why you're taking this medication?
You just said it. I have schizophrenia.
Okay, I'll explain it again for you. Haldol is an antipsychotic drug that decreases excitement in the brain. This is used to treat schizophrenia to control motor movement and verbal, such as Tourette syndrome. You have been diagnosed with schizophrenia, which is why you're prescribed this medication.
Oh, okay.
Do you take 10 milligrams of Haldol daily?
Yes, I take 10 because I take 2 5-milligram pills.
Okay. You take that 2 times a day, correct?
Yes.
Okay. It's good to know the dose amount so that there's no complications or changes to have an overdose.
Okay. What happens if I missed one though?
Take the missed dose as soon as you remember. Skip the missed dose if it is almost time for your next scheduled dose. Do not take extra medication to make up the missed dose.
Okay. I'm usually good though. I usually take it the same time.
Okay, so if you take it at 9 a.m. and you, let's just say forget you take it, what do you do?
But once I realize I would take it, and then if I am supposed to take another one soon, you gotta push that one back because you can't take both of them together.
Okay, yes, that's correct. Spacing out your medication regimen according to the time you take your missed dose is good.
Okay. So, like, how long is it gonna take for like the medication to work? Because last time I was here, they told me a few weeks, but it's been a few weeks. It's been a month, and I still have the voices.
Well, it varies per person. I will inform your doctor about your symptoms and this meeting, and he will make a decision on increasing your dosage.
Okay.
If you take too much medication, seek emergency medical attention. An overdose of Haldol can be fatal.
Fatal. What's fatal mean?
Fatal means that it can cause a lot of harm to you.
Okay, I won't do that then.
Are you currently taking any other medications?
No, I don't take anything else.
Okay, that's good. So it will reduce your chances of drug interactions, like if you took a sleeping pill, narcotic pain medication, prescription cough medicine, a muscle relaxer, or medicine for anxiety, depression, or seizures. You can be extra sleepy or slower your breathing. This can be very fatal.
Wow, that's a lot.
Other drugs may interact with Haldol, including prescription and over-the-counter medicines, vitamins, and herbal products.
No, I don't take anything else.
Okay, good. Just wanted to clarify. As you know, there is a chance for adverse effects with this drug, such as extrapyramidal side effects.
Extrapyramidal what? What's that?
There's a couple of different ones that can happen to you. There's acute dystonia, Parkinsonism, akathisia, and late symptoms can include tardive dyskinesia.
Okay. There's a lot of those too. Can you write those down for me?
Of course, I can write those down for you. It is also to It is also important to avoid certain things.
Like what?
Be careful if you drive or do anything that requires you to be alert, avoiding getting up too fast or sitting in a lying position, or it may cause you to feel very dizzy. Dizziness or severe drowsiness can cause falls, fractures, or other injuries. Avoid drinking alcohol. Avoid becoming overheated or dehydrated during exercise in hot weather. You may be very prone to heat stroke while you are taking Haldol.
Okay, that's a lot of stuff too.
Just a reminder, I will give you a printout of everything about this medication, but it can be taken with or without food. Do not stop using Haldol suddenly, or you can have unpleasant withdrawal symptoms. Ask your doctor how it is to stop Haldol safely.
Okay, I will.
And never take more than your prescribed dose.
Okay, I won't.
Okay. Here's the printout of the drug,
Thanks.
and we're going to make up a new appointment, hopefully within the next 4 weeks.
Okay, so that's gonna make my voices stop then, right? When I come back?
I'm going to talk to your doctor about the meeting and see what he says about your medication.
Okay, sounds good to me.
Okay? So my name is Tammy, and I'm going to be doing a debriefing about the meeting I just had with my patient who is a schizophrenic, and she's on the drug Haldol. It's a first-generation antipsychotic, which is a high-potent drug, which means a low dose can achieve therapeutic effect. I also had her in a non-stimulating room. I closed the door for privacy. She was communicating with me well. She was maintaining a little bit of eye contact, but she was asking questions, which means that she was ready to learn. And she was also able to tell me about her medication and tell me what the medication was in her own words. And I also washed my hands, and I also was able to identify who she was, and she was able to tell me her name and date of birth as well. These are our side effects of Haldol. The first one is acute dystonia, which is muscle spasms of the tongue, face, neck, and back. The second one is Parkinsonianism, which is bradykinesia, mask-like faces, drooling, and shuffling gait and tremoring. Another one is akalesia, which is agitation, restless movement, compulsiveness, pacing, squirming, and anxiety symptoms. And a late symptom that can happen is tardive dyskinesia, which is oral facial dyskinesia, which is lip smacking, involuntary movements of limbs and toes and fingers and trunk, malnutrition, and weight loss due to eating difficulties. Another side effect that can occur is dry mouth, which can be helped with chewing sugarless gum or having hard candy to suck on and increasing fluids.